Welcome everybody to the UNC Cardiology 7th Annual Women's Heart Symposium. And it's a nice chilly morning in North Carolina. I do know that on April 18th, 1983, it snowed on April 18th. So we didn't quite get there, but it's chilly enough. I'd like to welcome everybody and say that I'm very happy that people are joining us. We have some wonderful talks today. And we're going to start out with Coach Hatchell. But before we get to Coach Hatchell, please remember to use the question and answer button at the bottom of the Q&A at the bottom of the screen. If you have questions, and we'll answer them at the end. Coach Hatchell and I have known each other for a long time. Sylvia is a really good friend. She's a very big champion for healthcare. And actually, first though, before Sylvia, what I want to introduce is Donna Mcclatchy. Donna's with us today because she and her family have been big supporters of this Women's Heart Symposium. Sorry, I got a little ahead of myself. So Donna's going to say a few remarks, and then we're going to hear from Coach Hatchell, and then Donna will come back at the end. And I got to meet Donna through her mom, and who I adored, and she has always been a big champion of women's heart disease. Helped me get this symposium started many years ago, was one of the best things that could ever happen for making UNC and women's heart sort of a one in the same name in North Carolina. So Donna, I'm going to turn it over to you for a second.
Good morning, everyone. I was so excited to hear that over the course of 2 days, there have been over 200 women to join in this symposium. And I know that would just make my mom so happy to know that so many of you are taking a proactive approach to your health care. And we are so grateful for Dr. Miller and all of her colleagues in UNC Cardiology for all that they've done for our family. And so I'm thrilled to be with y'all this morning and to hear from Coach Hatchell and Dr. Miller and continue my own education of women's heart health. So thank you, Dr. Miller, and thank you, Coach Hatchell. I look forward to hearing from you both.
Thanks. Sylvia, are you ready to jump in? Sylvia?
Yeah, I'm here. Can you hear me?
Go?
I'm ready.
All right, go.
Okay. All right. Good morning, everybody. I'm in the beautiful mountains of North Carolina, and but this is a great opportunity for me to share how I feel about Dr. Miller and, of course, the heart program at UNC, just everything about UNC. But first of all, there's no one any better than Paula Miller. She just is fantastic, and she can relate so much to what's going on in the situations that women have, and not just with heart health, but with just life in general. So, but I want to just chat with you a little bit about, my experience. Just a few years ago, I had acute myeloid leukemia. It's the worst kind of leukemia you can have. And it's been over 8 years now, and I'm cancer free. But what I had over 60 years of age, I had just turned 60. Only 9% of people survived that. So, it was a very a rough disease that I had. But I want to talk to you about the fact that not just nutrition, you're going to have sessions on nutrition today as well, but more about a mentality that I had and the exercise programs. That is so, so important. And I'm just going to speak to you from my heart today and give you some, things that I went through, because like I said, I had the worst kind of leukemia that you could have. And I was down low. And but now I'm strong, I'm healthy, I work out all the time and everything. So, but first of all, it's a mentality that you decide to have. You can't control lots of times the illnesses and sicknesses and different things that life's going to throw at you, but you can control how you're going to handle it. Your mentality has so much to do with it. So, and your mentality must be pretty good, because you're on this call today and on this this seminar that we're having. So I congratulate you on that. So, the right mentality is so, so very important. And then, beyond that, and again, like I said, with your mentality, I got a few notes here I'm going to look over, but, like when I was in the hospital, I didn't stay in the bed. you know, I got out and, you know, exercised every day, even some days that I couldn't hardly get up or move around because of the treatments I was in. I would always walk around the hospital. So again, it was a commitment that I made to the exercise routine that I was on. And so, but then also, like I said, with the mentality, you know, you got to make it a priority, because, you know, there's a saying, if you don't use it, you will lose it. And that's very, very true, you know, with any kind of exercise that you do. But again, you know, I was in great shape when I got diagnosed with leukemia. I exercised all the way through my treatments. Every day I exercised, whether it was walking or just using the bands or whatever, anything like that. And so then, you know, always, all through my treatments and everything, the exercise was important to me. You know, even when I went home, I would walk, I'd do all my exercises because I made it a priority. And then as I got out of my leukemia and everything, it's always been something that's very special to me, and that I make a commitment to each and every day that I go through all this. So, you know, the exercise, and there's so many things that you can do. The Silver Sneakers is out there. There's all kinds of exercise programs that you can get involved with. And it doesn't matter if it's, you know, your heart situation that you're in with, which, you know, most of you today, that's something that you've gone through, or a situation you may be in. But your exercise and nutrition is extremely, extremely important. And so you have to make that commitment that you're going to exercise each and every day. It's going to be a commitment that you make, and then you get involved in exercise. You join a group or something like that, whether it's, you know, line dancing or Silver Sneakers, a stretching group or something like that. But having a support group and people around you and people that you can exercise with is extremely, extremely important. And, you know, because like I said, if you don't use it, you will lose it. And so, you know, exercise is very important, along with your nutrition. And exercise is so important that, you know, whenever I got out of the hospital and finished all my treatments and everything, you know, I was so committed to it. But while I was in the hospital, you know, I had to exercise in my room. We had nowhere to exercise. And that's where I am right now. I'm at my cabin up in the mountains. I have a blueberry farm here, and blueberries are one of the most healthy foods that you can eat. I'm sure the nutritionists are going to tell you all that. But we're having a work day tomorrow where people are coming and helping me. We got over 300 blueberry bushes here. But what I want to tell you is that it's an honor system. People come in the summer times and pick blueberries, and all the money goes to the Lineberger Cancer Center, where we've put in 2 workout rooms there for the patients to come and exercise. While they're there in the hospital doing treatments and all, then they can exercise in these rooms. So, you know, your exercise is extremely important. It will help you with anything that you're going through, especially any heart situations. But always get approved ahead of time by Dr. Miller or somebody like that as to what you can and can't do. And then you must make a commitment to it. You must make a commitment each and every day. Get up, get out, wrap up, go outside and walk. There's something that you can do. And at the beginning, it's going to be hard. It's going to be rough. But each and every day that I exercise, I feel better. It helps you mentally. If when you go out and you exercise, you know, there's just something about exercising that makes your mind better and helps you, you know, mentally as much as physically. And I know it's hard. I've been through one of the hardest cancers you can have, but I am healthy and happy and I'm strong, you know, and I'm here today because I want to help you. So anything I can do to help you, you contact me. I'll come and speak to you or a group or whatever. You know, you can call me. I can give you, you know, helpful hints about your exercise because I have made a complete commitment to that, and nutrition. And so I challenge you today to do that. And I'm so glad you're on this call. And like I said, you're going to learn so much information. It's so good what they do here. So you stay on here all day, call up some friends, other people to get involved, and you make a commitment to being healthy and happy, and your commitment here to Dr. Miller and to this program. And again, Paula, you're the best. Thank you for doing this. Thank you for including me, and anything I can do to help you or any of these other ladies, I'm here, I'm ready. And let's move on forward and let's get some really good information and knowledge about heart health.
Thank you so much, Sylvia. I think Sylvia has been around helping me out since I think the second annual Women's Heart Symposium, and I much appreciate your support and through all the years. But Sylvia had this great system when she was sick of her friends, and I think this is important to women in their heart health as well. Who you'll have to remind me how many, Sylvia, but I think there were 5 or 6 from your hometown that came and stayed with you every day when you were going.
Oh yes. Oh, I had 17 ladies that took care of me.
Yeah. So will you talk a little bit about that for a second?
About the support group?
Yeah.
Yeah. Oh yeah. I had treatments for 7.5 months, and I was high maintenance because I was on a neutropenic diet and everything. But my girlfriends all got together, and they did a calendar. There was 17 of them. And for 7.5 months, I did not spend not 1 second by myself. They were always there, taking care of me, helping me, encouraging me. You know, that was my support group. Mentally, some of them exercised with me. They fixed the foods that I needed to have, but I could not have made it without those ladies. I mean, they were just, you know, my rock. And they were there for me, you know, with all my situations. So having a support group, your family, your friends, you know, people that will encourage you, because it's hard when you go through, you know, health conditions and situations. And don't feel bad about reaching out to them. You know, and there was some, you know, and I'm always an upbeat type person. And let me tell you, it's okay. You know, some days I'd go sit in front of the mirror and I'd look at myself in there. You know, I was having a pity party and I was feeling sorry for myself and everything. And so, you know, I'd look in the mirror and I'd say, girl, look, now this is, you know, you do a checkup from the neck up and get rid of any of that stinking thinking you got in your head right now, because, you know, you got to be strong and you can do this. You know, I would give myself pep talks and look in the mirror and all that. But, you know, the support group that I had was so important. So don't be afraid to reach out to people and get some people to exercise with you. That helps you more than anything else. And you know what? I've learned with women, and you know this too, when you can talk, you know, you can forget about working and exercising. If you got somebody there to chat with and talk with, you know, you can do a lot of stuff, and before you know it, you finish the workout. So don't be afraid to reach out and get you a really good support group.
Thanks, Sylvia. I just got a message that my audio is not good. So let me know if I need to do something. I can turn it down to you. So much, Sylvia. And I think a support group and a workout group are really important. We're going to hear from my person, our minor, later today, and she makes the hour go by so fast because we laugh the entire time that we're working out, mostly because of the way I look when I'm doing some of the things that she has me do. But it's all fun and it's good for your health. So I'm going to talk a little bit now about how you can talk to your healthcare provider. So I'm going to share my screen, which is my slides, and what to know about your health and your numbers. So our health really can be looked at through numbers. And if you know what to ask your healthcare provider when you go see them, my speech may be a little different because I had Mohs surgery about 10 days ago and I still have some stitches in my face. So excuse me for that. But I want to start off by saying, if you don't think that you're going to have health issues or heart disease, then you don't really look for it. So Nanette Winger, who's the mother of women's cardiac health, says if a woman does not perceive heart disease to be part of her illness experience, she will not institute preventive intervention, nor will she respond appropriately. So that's what I'm trying to talk about today, is getting people to acknowledge that heart disease is something that we're at risk for, and that we will take steps to prevent that, and that in that way we'll make everybody healthier. If we had this lady around who was in the early 1900s, Lydia Pinkham, she was the mother of 3 boys, and her husband owned a sawmill or a wood mill and died early on. But she had started making this elixir that she made and passed around to all of her friends for kind of her ills. And it's if you can see it, you probably can't see all of it, but it says it does just about everything. It removes It dissolves and expels tumors. It will remove faintness, flatulence, all craving for stimulants, relieves weakness of the stomach, bloating, headaches, nervous prostration, general debility, sleeplessness, depression, indigestion. And it was, and they made it into a $300,000 a year business. Turns out it's about 50% alcohol. So if we had that, we might not need it, but Pfizer still has a patent as far as I know. But we don't have Lydia Pinkham, so we got to do things for ourselves. So what are your numbers? The first numbers people usually ask me about are their cholesterol numbers. What is my cholesterol? What should my cholesterol be? There are guidelines that will tell you the numbers. Total cholesterol less than 200, HDL greater than 40, LDL dependent on what your risk factor profile looks like, and triglycerides less than 150 if you've been fasting. Total cholesterol is a little bit less than 200 is a little misleading because I have some women who have HDLs of greater than 100 whose total cholesterol is between 200 and 300 because they have so much good cholesterol. One of the questions I get is how do you tell the good cholesterol from the bad cholesterol? And just very simply, HDL, you can think H for high, the higher the better, and LDL for low, the lower the better. Some patients have even pointed out that H could be happy cholesterol and that L could be lousy cholesterol. I think that's a good way to remember it. But the HDL and the LDL are the important parts of the cholesterol that you really want to know. There are people with triglycerides that are hypertriglyceridemia. Some of that's familial. It's important to take care of your triglycerides too. It's important to take care of all those numbers. So ask your doctor, what are my cholesterol numbers and what should I do? We can use these numbers to generate a risk factor profile, be it with in the cholesterol education panel or with the Reynolds risk score. But they all help us sort of decide what we need to do for our prevention, whether or not we need to take a medication, whether or not we need to take something just to lower triglycerides or work on our blood sugar, which is the next one is blood pressure. Blood pressure is very important. It's the silent killer. What should our blood pressure be? Well, ideally, what you read in the literature is 120 over 80 is normal, but it also is patient dependent. I mean, each patient, given their age, has a different range. So we aim for less than 150 over less than 90, generally in people over the age of 60 with a goal of keeping it around that or less. High blood pressure is the major cause of stroke. That's why we want to know those numbers and ask your doctor, where should my blood pressure be and how should I do it? It takes approximately 2.8 medicines per woman to be controlled. Up until about 50, women have less high blood pressure than men, but at 50, women start to cross over and our risk of high blood pressure goes up. If we live to be 85 years old, we have an 85% chance of having high blood pressure. So don't be surprised if as you get into your older years. At age 50, I was 90 over 60, and age 51, I was 160 over 100, and nothing had changed. My weight, my exercise habits, nothing. But my parents were hypertensive, so I became hypertensive, and it becomes very important to watch your blood pressure and to take your medications. But know that that is a possibility for you, and ask your doctor, where should I be? What can I do? Blood sugar is so important. Blood sugar levels can indicate diabetes or pre-diabetes. We now look at A1C, which is a measurement that another number we should know. Generally, if you're less than or greater than 5.8 to 6.4, you're considered glucose intolerant. Above that, you would be considered diabetic. Diabetes is also sort of a silent killer at times. The time between you develop diabetes and when you're diagnosed is about 2 years. So if we screen and know your blood sugar early on, have your blood sugar checked at your doctor, you may pick it up before it becomes really overt and do something about it when you're in that pre-diabetic stage. It can be dietary, hopefully no medications. Exercise is a wonderful way to keep your blood sugar levels down. If you're a woman and you're diabetic, you have 7 times the normal population's risk of developing coronary artery problems or cardiovascular problems. So there's a really good reason to keep your blood sugar level under control. I have one patient that's 32 that was diabetic, a juvenile onset diabetic, who had her first heart attack at 32. Probably just diabetes was the most important risk factor for her. Know your weight. And this one's really hard because as we get older and past menopause, there's just this little weight that just kind of creeps in. I wish it didn't do it, but I call it should try to find out a woman, but I call it the John Travolta phenomena. If you remember when John Travolta played Denny Barberino, it was this nice skinny little guy, and now he's in the male postmenopausal, and he's this big hunky guy, or James Kirk from Star Trek, little skinny guy when he was Captain Kirk, and now he's a big heavy guy. We gain weight as we get older. There's just no way to get around it. And as women become postmenopausal, they tend to shift that weight toward the center. And you'll hear some of that from Judy Hindeleiter when she talks about nutrition. But know your weight. Get a scale. Weigh yourself daily. It can be a sign of so many things, particularly heart failure. If you start to gain weight unexpectedly, or you begin to have swelling, weight is such an important number. We want to keep our BMIs in that normal range as long as we can. Know your steps and activity. There are all kinds of trackers and devices out there. You don't have to have one. You can just count the number of minutes of activity or the time that you do exercise. But the guidelines suggest 10,000 steps a day. Working in a clinic now, particularly that we've moved to Easttown, it's very easy to get 10,000 steps a day in when you're in full day clinic. But go out and take a walk. It doesn't have to be aerobic activity. It just needs to be steps, just staying up and active. These kinds of trackers, like this is an iWatch, will tell you also how much you've been standing all day, what your calorie burning level is, and it'll also give you little kudos when you do something good, like little buzz on your wrist and say good for you, or you've hit a milestone. Exercise time. This is sort of exercise time in aerobic exercise. We would like to see people do 30 minutes 3 times a week. Varying intensity and in heart rate as you tolerate. You don't want to start out and say, oh, I'm going to start exercising and here I go, I'm going to do 30 minutes. And you go out and do 30 minutes and you come back and go, I can't do that again because it hurt so much when you did it that time. Start slow and increase over time. But a good goal is 30 minutes 3 times a week with a 5-minute warm up and a 5-minute cool down. And that the cool down is really important. That's when your muscles are trying to relax and get back to their steady state. Intensity can be speed, or if you're on a treadmill or a bike, or it can be resistance. And know your heart rate. You can calculate your heart rate from just your age, or you can ask your doctor to help you calculate what would be a good target heart rate for you. I do that a lot for my patients. I'm getting, know how much you smoke, if you do smoke. I'm happy to say that less than 20% of the population smokes these days. So that's good, but how many cigarettes a day is important. And I do still have women who smoke. So be aware that that is probably one of the worst things you can do. I think a woman with her first heart attack, 64% of the women are smokers or have been recent smokers. So if you do smoke, watch how much you smoke, and if you can, absolutely, it's the best thing to do is quit. How much do you drink? Well, everybody that I've talked to, for the most part, during the pandemic has increased their alcohol intake a little bit, just because it's been such a stressful time. But ideally, 1 drink a day for a woman, and that can be a beer or a glass of wine or 1 mixed drink, is the goal, or is the ideal. And varying articles will say various things. Abstaining is probably the best, but if you do drink, try not to drink to excess. Take charge of your health, know your numbers, get out there, be active. And, as I would always say, the Amway method, if I tell 2 people and you tell 2 people, then eventually we have this sort of mountain of people that now know to take charge of their health. And I very much appreciate you guys listening to me talk about my numbers. I know I'm from the South and I talk fast, so I'm happy to answer questions. Brian? Okay.
Hey, Dr. Miller, thank you so much for going over all that with us. Just really great information. Yeah, no, that's great. I think that we're gonna have you introduce Donna again and let her talk about her family's experience with you and their care at UNC and what motivated them to get more involved. So I'll hand that back to you.
Okay, so Donna, you've had a lot of introductions, so I'm just going to let you jump right in. But Donna and her family have been very important. Her mom, particularly, very important. And I think this is your mom's birthday month, right?
Yes, she would have been 75 on Monday. So we're keeping her extra close in our heart right now.
Well, we're dedicating this year's symposium to your mom for all her support and help in the past.
Thank you. That means so much. I'm really honored and thankful to be a part of this symposium for so many reasons, and one of which is because it did mean so much to my mom. She just had a real passion for seeing other women educated regarding their heart health. And as someone who is very quickly approaching 50, I'm realizing that it is never too early or too late to really take control of your health. And Dr. Miller and her colleagues, like I said before, have just been so amazing, and they were so great in the care that they provided for my mom. And my dad has also been the recipient of some great care at UNC through the cardiology program. So we're thankful for that as well. But in 2008, my mom had a Vtac, and the survival rate for a Vtac is incredibly low. And miraculously, she survived. They were at the beach that weekend, but she was transferred to UNC. And because of their care and their ability to diagnose and treat, she made a miraculous recovery. And our family ultimately believes that the Lord had his hand on her life. But we also believe that the Lord has his hands on people like Dr. Miller and has gifted them with the knowledge and the ability and the intellect to treat and diagnose all sorts of issues. So we are incredibly grateful. And ultimately, cancer ended up taking my mom's life, but we are convinced that the care that she received at UNC gave her an additional 10 years. And, that's 10 extra years with her grandchildren, 10 extra years with me, 10 extra years with my dad. And so we really, this Heart Health Symposium, the more you know, the more you take charge, you are giving your loved ones more opportunities to be with you and to experience life to the fullest. I loved what Dr. Hatchell said, that it really takes a mentality and commitment. My mom made exercise a priority. She reduced the sodium in her diet. Any little tips and tricks that her doctors were telling her, she was the first one to jump on the bandwagon and make those adjustments. Now, I will tell you that every once in a while, we love to indulge in a hamburger, and we would do that. But I think Dr. Miller would tell you moderation is okay. But for the most part, she did a great job of really being very cognizant of her diet and nutrition and her exercise. And so all of these things are just so important. And we saw such a difference that those things made. My mom shunned the limelight. She did not like it, but she did love supporting programs like this that enable people like Dr. Miller and all the other amazing clinicians at UNC Health to really bring forth their gifts and their talents in helping other people. So thank you, Dr. Miller. You have been a wonderful friend, a wonderful physician, and we are so grateful for everything. And I hope everyone that's listening today will take away several different nuggets of information and really put those into practice.
Thank you so much. It means a lot. And your mom was she was one of the patients that would do what you asked her to.
Wow.
Dr. Stauffer was her physician of record, but I always got to come say hello to her.
Well, and she always appreciated it. And she knew that y'all knew what you were doing. So she was taking everything that y'all said to heart. No pun intended. Well, maybe pun intended.
That's good. That's good. So Brian, you want
Yes, yeah, I'll jump in. Donna, thank you so much for joining us. I've had the pleasure. For those of you who don't know who I am, my name is Brian Franke. I'm Director of Development for UNC Cardiology and work with the UNC Health Foundation. And it's really my honor to be able to work with physicians like Paula Miller and also families like the Curtis family. As Dr. Miller stated earlier, this symposium began as an idea that she really pushed forward early on with very little resources, and due to the generosity of the Curtis family and also the action of women like Barbara Curtis, Donna's mother, who I was very fortunate to get to know over my time when I first became the director of development here. She served on our board of directors and was just an amazing woman, just the most kind, loving, and caring person, but also very, very intelligent, very astute, and really was able to help us as an organization seek the best ways to move forward and how to use our resources wisely. And one of the things that she really believed in was supporting Dr. Miller in this symposium. And that in a large part allowed Dr. Miller to expand the services and include more people and invite and open it up to anyone and everyone who wanted to come without paying. So just like today, obviously it's virtual, so the costs are a little bit lower. It's more manpower, but if anyone has gone to the symposiums in the past in person, there would be a heart healthy lunch that was part of the symposium, and it was a symposium that was free charge. And that was in large part because of the generosity of families like the Curtis family. So Donna, I wanted to just personally say thank you to you and your parents for all the support that you have given to UNC Cardiology. And I hope that inspires others, and it has. So I'll speak a little bit more to that in as we close today on how you might get involved if you'd be interested in doing so. But I'll move on to our question and answer session. So we've got a few good questions. One that just popped up a little while ago that I thought was interesting, because I know my wife would love to hear about this. The question was, well, what size waist should a female have? Is there a certain number that women should aim for, like 35 inches?
35 or less. You don't want to be over 35 and ideally below 30, but 35 is sort of the magic number. So to try to keep your waist lower than 35. And that becomes harder with our central body, with women sort of sinking to the center, becoming more apple-shaped as we get older. The waist tends to get a little higher or a little larger. What we can do to help with that is to do some core training, to do some strength training with your abdominal muscles. That will help. Eating less carbohydrates will help. If you drink alcohol, stopping alcohol or cutting back on alcohol will help, because that has lots of sugar in it. Things that have lots of sugar tends to deposit or make you deposit more centrally. So high carb, high sugar. That's
great. That's great. That's great to hear. And as if you noticed in the chat, there is a link. If you haven't signed up for it, our next session at 11 is going to be focusing on nutrition and exercise and things that all of us can really adopt to help us. So just a little promo for that. The next question, do females with a heart murmur, so mitral valve a slight problem with the mitral valve, need to still take prophylactic antibiotics before teeth cleaning?
Not with just mitral valve issues or mitral valve prolapse. If you've had a replaced valve or you've had some sort of mechanical intervention in your heart, then yes, you do need to take it. But I would say bicuspid aortic valve is probably the only just natural occurring reason to take antibiotics before dental work, not just mitral valve prolapse anymore. That was what we thought for years and years and years, but in the last 10 to 15 years, we've quit doing that, knowing that antibiotic resistance is far worse than taking the antibiotics prophylactically. Now, if you have a prosthetic joint of some reason, you will be taking them, or any kind of prosthesis, you would, but not just for mitral valve prolapse. I wanted to just say before I forget, because that things run through my head, that if you did sign up for today's seminar, you will still get your 7th annual Women's Heart Health t-shirt, or Women's Symposium t-shirt. People that came to the very first one say, am I going to get my t-shirt? Yeah, you will. That's part of our keeping it going and keeping our name out there and having you wear it proudly.
That's great. My mother, by the way, Paula, Dr. Miller, actually called me yesterday and said, hey, am I got a t-shirt too? I said, yes, I think I can get you one. I said, first you need to get on in the morning to listen to the numbers.
Absolutely, and a flash drive with all our slides.
There you go. Yeah, which is an amazing resource. That's just one of the many things that our participants, attendees have received over the years. So that's just it. You know, like I said before, we've been able to do so much where we want to do more. A follow-up question. I think this is a great question. What is a Vtac? That's a question that popped up after Donna's comments.
So Vtac stands for ventricular tachycardia, and that is a form of sudden cardiac death. That and ventricular fibrillation, and that's when your heart goes into a rhythm that it can't sustain. There are people who have ventricular tachycardia that tolerate it for short periods of time. Some young folks can have a ventricular tachycardia that is exacerbated by exercise. It's very, very rare that you see something like that, though. But an adult ventricular tachycardia becomes a lethal rhythm unless you seek help early. One of the things that we've done in the last 25 years is, as you notice at the malls or places where we used to go, there are defibrillators just about everywhere. The automatic external defibrillator, and that has improved our rate of sudden death because they're at sporting events, they're in the mall, they're in our building, they're in all the medical school buildings. We pushed to get that done over 10 years ago. Yeah, way over 10 years ago. Each medical school building had an AED on the first floor. So if you have a lethal rhythm, it's really important to get help to that person, at least CPR during the first 4 minutes, and have an AED available if you can. The firemen are the first responders, and they all carry AEDs, and there's a fire station pretty close to everybody. Yeah. I think I see is AVIT, a question about is that AFib dangerous or VFib dangerous? You see the question, Brian?
I didn't get the question, but I mean, I was actually going to follow that up with just, you know, the different arrhythmias and how they can affect, obviously, your health. So that was interesting.
Atrial fibrillation is an atrial arrhythmia as opposed to the ventricular tachycardia and the ventricular fibrillation. Atrial fibrillation is when the top part of your heart is not functioning or not pumping appropriately. It's sort of bombarding the bottom part of your heart with little impulses and becomes very irregular. That by itself is not life-threatening generally. If you don't get it taken care of and get it rate controlled and get anticoagulated, then it can become an issue. Dr. Baker is going to talk to us about that a little later today. It's a very common rhythm. Dr. Gay, who's the head of our EP division, once told me that it was in 1 in every 4 people I knew. So that's a lot of people that you think about, but it's generally prevalent over the age of 60 and in people who've had hypertension. But by itself, it's not life-threatening. It's just the ability to or the possibility of having stroke if you're not anticoagulated.
Right. Yeah, and just the feeling of when your heart goes into arrhythmia from AFib standpoint is just really,
They describe it, or people describe it as quivering or feeling like they can't take a deep breath because their heart rate's so fast.
Yep.
That it accelerates when they get up and move around, or they accelerate when they lay back. Again, it's it is a more common arrhythmia, and you don't want to have it, but if you do have it, it's one of the things we can control and take care of.
Yeah, it's treatable. It's treatable.
It's treatable.
So another question that I see is, do vegans have higher triglycerides?
You know, I don't think so. I have not looked that up specifically, but it doesn't. Triglycerides are how your body absorbs all the fats that go into your system. Everything is absorbed in your gut as a triglyceride, and then from triglyceride, it is broken down into the VLDL and LDL and HDL, the different components. It wouldn't make sense that, because vegan is not a high fat diet generally, it's a plant-based diet.
Right.
So you don't get much of that type of the triglyceride fat with vegan diets, I think.
Right. One question that I would like to pose, and just for all of our attendees to be able to hear, is, what are your recommended first steps, Dr. Miller, for, because I actually know that there's some folks who are on here today who have not had to see a cardiologist, have not had heart disease issues. Do you recommend that they ask to see a cardiologist, or should they just continue to see their primary care physician on an annual basis?
I think most primary care physicians do a really wonderful job of taking care of basic cardiovascular risk, cholesterol, blood pressure, weight. I think when we want to see a cardiologist is if you have questions about women specifically, or if you have a family history that somebody in your family passed away early from coronary artery disease, say in women before the age of 60, people had heart disease, or in men before the age of 50, people had heart disease, then that puts you at higher risk. And it's mom and dad really count. Brothers and sisters are more predictive. So if you have brothers and sisters, then I definitely would suggest getting in with a cardiologist and being followed that way.
Yeah, that's great advice.
Certain things like valvular heart disease that should be followed by a cardiologist. Mitral valve prolapse, if you have regurgitation, it's I think that the recommendations right now are every 2 to 3 years for an echocardiogram. If you have a bicuspid aortic valve, you definitely want to be followed by a cardiologist, because that is something that will progress to stenosis at times. There are various, I guess heart history is probably the most important for seeing cardiology, but what we do in our clinic, or we like to do in our clinic, is just do preventive medicine and sit down and talk about what the goals are the guidelines are from the American College of Cardiology and the American Heart Association, and just go through a list and see if you're doing the right things. If you're a woman and you don't eat fatty, or you don't eat fish twice a week, do you need to take fish oil capsules? And I think Judy's going to talk about that a little bit later today, but getting your steps in, watching out for peripheral artery disease, which is now one of the risk factors in women. So you have cramping in your legs. So I think everybody needs to see a cardiologist, but I think there are specific groups that could benefit, and any woman could benefit from a once a year check up with a cardiologist to go through heart health issues and things that have changed. When I started my fellowship in, I hate to say this, but it was 1989. The goals for blood pressure at that time were less than 150 over less than 105. That was your goal. If your pressure was lower than that, then you didn't get treated. And we now know that that's way too high. When I started in cardiology, you took hormones for cardiac protection. We now know from the trial that came out of Wake Forest, we don't do that anymore. That it's actually harmful to take hormones, and it should not be used for prevention. So things change as we learn more over the years. One of the biggest risk factors, a bigger risk factor for women these days, is if you had pregnancies that were complicated by preeclampsia or eclampsia, or you had a preterm child and they determined preterm was earlier than 37 weeks, then you're at risk down the road postmenopausally for an increase in cardiovascular disease. So those folks, we want to be more aggressive with something obviously in their vasculature. It's different. But those are questions that we didn't know to ask 25, 30 years ago that we're asking now, that make a difference in how we suggest prevention.
Yeah. So I think like what I'm hearing is know your numbers and preventive medicine, take care of yourself. Like Coach Hatchell was saying earlier, try to take care of yourself and know your numbers. So another follow-up question, how can stress affect your heart rate?
Stress does a lot of things. Stress will affect your adrenaline level, and your adrenaline level will affect your heart rate. But stress affects other organs in your body too, as it affects your heart rate. It keeps your mind going. It may make you sleep more poorly. It may make your appetite be less healthy, but it definitely can increase your heart rate and keeps you at a higher level just from that little bit of adrenaline that's there.
Great, thanks for that answer. What are your thoughts on a high fat? Well, I'll ask you this, and then we'll hear what Judy Hindletter says later. What are your thoughts on a high fat diet to lose weight?
Well, that's kind of going back to the old can't remember the name of the Atkins diet, where you ate high fat, low carb. I've never been a big fan of those. I think that a diet should be something you can sustain, not something that's sort of that you can do for 2 to 3 or 4 weeks and maybe lose 5 pounds, but then as soon as you go or try to ease back to a more normal diet, that you can't keep it up. So finding something that you can do that you can sustain will be the best way to lose weight and to keep weight off. And then Dr. Judy will talk about, Hindletter will talk about this too, is that losing weight at a slower rate, 1 to 2 pounds a week, will stay off much better than doing a high fat diet and losing 10 in a week or 2 weeks, and then it'll come right back. So think about what you eat and try to find 100 calories a day that you can reduce, and you can lose weight that way. You have to keep adjusting because you're losing weight. There's also this a good calories, bad calories. Actually, it's on the internet, but there was a book, Good Calories, Bad Calories. And if you eat like 100 calories of white potatoes and you eat 100 calories of sweet potatoes, you are going to be more likely to lose weight or maintain your weight by eating the 100 calories of sweet potatoes than the white potatoes, just by the way that you metabolize. So choosing the kinds of calories you eat. It takes more calories to chew up celery than celery has in it. So things like that will help you. Not that
just don't dab a big old thing of peanut butter on it.
Yeah, that's true. Well, yep, that's true. Peanut butter is good protein, though.
And I think one final question: how concerned are you about the frequency of PVC?
So PVCs can be totally benign. They can come for many, many reasons and have no implications whatsoever. And that, for the most part, that is the case. They can be during high stress times. They can be if you're a little dehydrated. You can get them if you sleep poorly. You can get them if you drink multiple cups of coffee a day or take any kind of stimulants a day. And in a structurally normal heart, they do not mean anything bad. It's in folks that have had cardiac issues or scars in their hearts. That's when we start to worry about them a little more. But by themselves, they generally don't predict anything that's will affect your mortality down the road.
Okay, great. Thank you, Dr. Miller, for our Q&A session. I want to thank Donna Mcclatchy and Coach Hatchell for joining us today. And obviously, we all want to thank you, Dr. Miller, for what you do and being so dedicated to the women of North Carolina, but also to be dedicated to doing this each year. This is something that obviously last year we weren't able to do because of the pandemic onset. But I know we started talking back last fall about what this would look like and how we can do it and try to make it even better. And I hope that everyone today who has joined us has really gotten a lot out of the presentations and just the keys to life and the keys to heart health that you have heard.
We actually did do it last year, didn't we, Brian? Didn't we do it in February of 2020?
Did we move it? Did we do it? Yes, we did. I'm sorry.
Yeah. We haven't missed a year. That's the goal. We just moved it up.
Just keep on going.
Can I answer one other question that was on there about somebody asked about sleep? And
I didn't see that one. I'm sorry.
So sleep is very important, and 7 to 8, as many as 9 hours of sleep, depending on how your age. It helps sort of reset your body in all different kinds of ways. Like with the PVCs, it can make you more susceptible to arrhythmias, atrial or ventricular, if you don't get enough sleep. It can make you daytime fatigue. You can't do as much as you normally do, or can't be as active as you'd like to be. You may not exercise as much because you feel sleepy from the evening before. But It can be it can exacerbate atrial fibrillation if you don't sleep well, or there's just good sleep habits are important.
Mm-hmm. And I see there was one last one there, and we have time for it. So if you want to,
a regular heartbeat rate be causative factor for stroke, and absolutely yes, atrial fibrillation is a risk factor for stroke, not just an irregular heartbeat. If you're having skip beats or premature atrial beats or premature ventricular beats, but atrial fibrillation. So if you're having skip beats or you feel like your heart's fluttering, it's important to talk to your primary care or to see a cardiologist so they can rule out that it's not atrial fibrillation.
Right, right. Thank you, Dr. Miller.
This is fun. This is my favorite part.
Yeah, exactly. Thank you, everyone, for the questions that you submitted. If you have any further questions, please don't hesitate to reach out to Dr. Miller, or you can reach out to myself as well. And Dr. Miller and I talk very frequently, and I'll get that to her. Did you have anything else, Dr. Miller?
No, just I appreciate everybody coming. Look for your T-shirt and your flash drive, and we will be back hopefully in February next year, back on schedule and maybe back at the Friday Center. Or ideally, my goal is to do it in a couple of times a year in different parts of the state so that we can get our information out to more people.
Exactly. We want to grow this thing, and I know we will. Thank you so much. So to wrap up today, a few house cleaning things that I would like to share with everyone. You will receive a very brief survey. That survey is really, really helpful for us for this symposium, but also for the many virtual events that the UNC Health Foundation has each month. So if you have another topic that you'd like to learn about within the healthcare spectrum, please feel free to include that on the survey. But if you have a minute or two, we'd appreciate you filling that out. And if you'd like to learn more about how you can get involved and support Dr. Miller or other areas within UNC Cardiology, you can do so by going to our website, unchealthfoundation.org, or you can reach out to me. I'd love to talk to you over the phone, through email, whatever works for you. But I can share information with you that you might be interested in learning more about how you can get engaged and be involved and help Dr. Miller and our other physicians so that we can take care of the people in North Carolina and beyond. The last thing that I'd just like to say is again, how much I appreciate Coach Hatchell taking the time out of her day and being up in the mountains to join us today. And then Donna, thank you so much. We really appreciate you and your father and what your mother has meant to us. And thank you, everyone, for joining us. Dr. Miller, I'll see you in about an hour. And I hope that many of you join us. We'll see you soon. And if not, have a great day. It's a beautiful one out there.
Yep. Thanks so much, everybody. Bye.